Welcome to my world. Yes, another opportunity to really talk about our health and also proclaim the slogan, health is wealth, knowledge is power. Today's topic is also in the region of anemia. So we are talking of aplastic anemia. We all know what anemia is because it's very easy to say shortage of blood. Many of us even emulate medical doctors by simply checking the eye for whether the eye lid is pale or the palms are pale, so which we regard as pallor, that is probably needing the micronutrients or even blood transfusion. But you can never be accurate or definitive in declaring anemia through that method. Is always the lab. But now there is even a tougher one, which is aplastic anemia. What is aplastic anemia? So join me as we go into the slide section to really explain and expose what aplastic anemia really is. It is always the function of the lab to give a definitive statement on it. If you like my video, my channel, just press the like button, subscribe, and every time you will be notified. Thank you. Let's start with the outline. Definition of anemia. We move on to also definition of aplastic anemia, types of aplastic anemia, pathophysiology, aplastic anemia symptoms, classification of the severity of aplastic anemia, diagnosis, and finally treatment. The definition. Anemia, we must start with anemia because generally we believe we know anemia, but the real definition that has to do with exact figure, more of a figure that declares it anemic, because when we just say generally shortage of blood, it does not define the cause as well. Blood deficiency, yes, shortage of blood. A blood condition in which there are too few red blood cells per cubic millimeter, or the red blood cells are deficient in hemoglobin, which are contained in the red blood cells per 100 ml, or the red blood cell fraction of blood, hematocrit, is below normal, resulting in poor health. Common causes include a lack of dietary iron, hemorrhage, heavy blood loss, maturation deficiency, or the production of too few red blood cells disorder. The primary, when we know the cause, is called secondary, whereas anemia that are of unknown causes. A form of anemia too that is also of unknown causes is the Plummer-Vincent syndrome, developed because of insufficient vitamin intake, iron deficiency, upper esophageal web, and may be followed by cancer of the throat. But timely treatment of the anemia by brown yeast and green vegetables said to prevent the cancerous development. So these are part of advancement, but the cause is 100% not known. Now let's move to aplastic anemia proper. In aplastic anemia, there is a reduction in the number of red blood cells, 1. The white blood cells, 2, and platelets in the peripheral blood, pancytopenia. So it is very easy to conclude that it must be an attack on the stem cell that form the myeloid or the other series, blood-forming tissues, if in an adult, the bone marrow, and possibly in the thymus and buccal prepuce or the fetus, though these are really not confirmed, but you could believe that that's a possibility. Causes could include drugs like chloramphenicol, non-steroidal anti-inflammatory drug, cytotoxic drug, viral infection, hepatitis virus, CP viruses, and you are talking of ionizing radiation, that's when the X-ray, alpha, beta, and gamma rays are concerned. The ionizing radiation really knocks out the atoms, and it's like going deep and ionizing the electrons in the nucleus of the atom. Now let's look at the typical blood. This is a typical blood, like I've always been explaining. This is the erythrocytes, the red blood cells. That usually when you are talking of anemia, this is our area of concentration. That is either this is too few, or the content, hemoglobin content is low, or the iron, because hemoglobin really traps the iron. But outside this, now the anemia of aplastic anemia affects all these other cells, namely macrophage, monocytes, lymphocytes, neutrophil, eosinophil, basophil, and platelets. All these cells perform different functions. All these white cells are for defense mechanism to protect us, especially against infection. So you can expect when there is a low number of all these cells, there is bound to be serious infection. Then the platelets also help to stop bleeding. So the part of the symptoms of patients that have aplastic anemia is that they bleed as well. So let's look at, this is a typical normal red blood cells. You can see that there's so many, because you are talking of trillions of red blood cells per liter. And this is the aplastic anemia picture. You can see the red blood cells are now not so many. The white cells are just, you can count them in this feed. The platelets you can still see much anyway, because these are platelets. Now, type of aplastic anemia. We are talking of the severity of the aplastic anemia as we go on into the classification. But right now, let's look at the type as acquired, or when it is primary. The primary type is of unknown origin. So the acquired aplastic anemia is common in adults. Possible causes for the condition include immune system trigger, such as I've listed earlier, HIV, toxic chemicals. We have talked of even ionizing radiations. People who are even undergoing chemotherapy, they use radiations anyway. We still now talk of the other type that affects children. It is the primary type that you don't even know the cause. Inherited aplastic anemia is most common in young adults and children. It is caused by gene defects and suggests a higher likelihood of leukemia and others. So the cause is suspected. I mean, we can easily pinpoint that since it's congenital, it has to do with gene defect. But when it's a primary problem, you don't really can say. But because of genomics, right now we have been able to study so many of these genes, and it's now coming down to knowing what gene is really affected. Pathophysiology, you look at, in some cases, understanding clearly how this aplastic anemia works. An autoimmune reaction, that is a reaction of the body immune system attacking itself, in which the body immune system attacks its own tissue and organs, is held responsible for the bone marrow damage. T cells of the immune system attack the hematopoietic stem cells, like I said, and destroy them. This suppresses blood cells production and subsequently cell division. So, inherited form of aplastic anemia, which we have mentioned, that is genetic type in children by genetic factors, are usually observed in first decade of life. The common one is Fanconi anemia, is the term used to specify a hereditary form of anemia. This is that which is called anemia. You can imagine a child coming down with this kind of problem. This is the acquired in adults. The picture shows it clearly. This is the bone itself. The bone marrow is that soft, spongy tissue there. Now, the stem cells are inside the bone marrow, so you call it hematopoietic stem cell. These hematopoietic stem cells, when they are genetically altered, it's either by the congenital inherited genetic defects, or when in adults, by viruses, drugs, or ionizing radiation, X-ray, gamma rays, alpha, beta rays, which is 80% of the cases. This is not as common as the acquired type. So these genetically altered stem cells now produce antigen which stimulate the T cells, the T helper cells response. The T helper cells now produce cytokines, interferon, and the nuclear factor, which will now attack the stem cell more and cause more damages, resulting in leukopenia, anemia, and platelet thrombocytopenia. Altogether, these three are called pancytopenia. The root here for the congenital, you can see, it now affects these stem cell and the reduced proliferative and differentiative capacity. So at this stage, you cannot differentiate to WBC, red blood cells, or platelets. So that is what causes the depletion. Now, aplastic anemia symptoms. Let's look at the symptoms. So many: headache, dizziness, nausea, shortness of breath, irregular heartbeat, bruising, lack of energy, or tiring, fatigue, abnormality. So this can be picturized in this form. You can easily see it. The skin rash, headache. It's common with children. Irregular heartbeat, uncontrolled bleeding because of the platelets deficiency, dizziness, fatigue when you don't have enough blood, you don't have oxygen circulating around you, the cells will all die, and that is why the fatigue is there. So classification of the severity is the next. So we are now talking in terms of, if you want to talk of the severity, you talk in terms of the neutrophil count, platelet count, and the reticulocyte count. When it's not so severe, these are the values. When it's severe, you get this value, and when it's very, very severe, the A stands for aplastic anemia. So we are now on to diagnosis. We can start by knowing the complete blood count. So from knowing the blood count, we can know the problem. So the normal blood count we do is the hemoglobin values. You can see the white cells, they are in billions, platelets are in billions, and even red cells, they are in trillions. So you can see their value for male, and then it's different from female. The male is always higher. The neutrophil, you can see 20% to 75%. But when there is a problem, the neutrophil and all of them maintain that balance, because it's just the count, the production, that is slow. The differentiation almost remain the same. So the peripheral blood may not be, when you do the smear, you may not get the true picture, but you will see that they are scanty. The other one is the peripheral blood smear, where we do the film readings. What you get is, like I said, very scanty number, but they are all looking normal. Then the puncture is for bone marrow examination, when you really want to go into serious study. The biopsy, you will see that in the bone marrow, the red cells are inflated and some are very big. Retics, you see reticulocytes, immature red cells, and all of them not many. They are not many, showing that there's a gradual decrease in their production. You can also use molecular testing to really probe and identify the missing one, and also PNN testing. We use flow cytometry to identify copies of abnormal stem cells and determine how active they are. Maybe uses laser beam to help measure the characters of abnormal cells. Now we can go on to treatment. The treatment, the first thing is, if it's the acquired type, you want to stop the treatment. If it's chloramphenicol that is causing the problem, if you stop the underlying cause, and obviously the aplastic anemia will not become serious, it will be less severe. But if it's more than that, then bone marrow stimulants could be given. When blood cells counts are low, bone marrow stimulating drugs are given to boost the body production of blood cells. There's also blood transfusion. A blood transfusion is preferred to replace blood and components that may be too low, but transfusion cannot treat aplastic anemia. Stem cell transplant, yes, this can take care. A bone marrow or stem cell transplant can cure severe aplastic anemia. And finally, because they are prone to infection, like we said, certain